lawsuit and has been integral. He's on the executive committee or whatever they call it for the pharmacy litigation. And he indicated that the article was a little bit ahead of itself, that there haven't been agreements signed yet for any of the things. So he really can't tell us exactly how much money there will be, but that's rough numbers. The Cuyahoga County, if those numbers are right, would get approximately $2.5 million. We are in this settlement because we did not, our lawsuit that we took, that Prosecutor O'Malley and I handled, did not involve the pharmacies. It involved manufacturers, et cetera, but didn't involve the pharmacies. So we are in this settlement and will benefit. So we benefit in two ways. One is our direct local portion. The other portion would be the portion that goes to the foundation. We will be, everybody in Ohio will be allowed to seek to have projects that they submit to the foundation approved and have those funds allocated through the foundation. I think one of the key in the meetings that Matt and I attended at the foundation, the thing that's being debated right now is how much flexibility the foundation will have to reject or modify applications that come in. So it's not a set, everybody who applies up to a certain amount in Cuyahoga, for example, gets that money. That we could get nothing, we could get more than our share. It just depends on how the bylaws end up getting written, how much flexibility is given to the foundation. I've been arguing for no flexibility at the foundation, give the money to us, but we'll see what happens. I can't speculate where that's going, and it'll be up to Judge Mattia to carry that ball if he chooses to. I would also mention that the newspapers wrote about the Walmart settlement. There is also in the works settlements with Walgreens and CVS. Those are less far along in terms of definitive numbers, but Frank thought that could be as much as $5 billion apiece. So once again, there'll be some money coming back to Cuyahoga County from those settlements once they're memorialized. So while nobody will get what we got up front with our $100 and whatever million, but there'll still be some change coming our way. So that's all good news. Something we can look forward to, and it'll be up to this group to come up with the proposals that we want to submit for money from the foundation. That's going to be a key function of this council.
Through the chair, Armin, so there's an amount that's kind of been estimated that our region would get over 18 years, that first thing.
Well, the first one, that's a good point. The timing is also critical here. The $3.1 billion is on a shorter time frame than the 18 years that we've heard about on other settlements. So that could be as short as 5 to 10 years. And I don't know what the time frames would be for the Walmart and Walgreens and CVS settlements.
But so just to clarify what you're saying about the control by the foundation, so that 18 million over or 14 million over 18 years that we're supposed to get, that will be proposals that this regional board gets. And your point about the state entity is that they may not approve everything we bring to them. So, people aren't going to them directly. Everything's still coming through this region, right? It's just the state may say, oh, no, we'll do some, we won't do others, right?
It won't be the state, it'll be the foundation.
The foundation board, yeah.
And the state has a number of seats on the foundation board.
And the Walmart money, same thing. When it comes, same way through the region, but not guarantee that they'll approve all of our
Correct.
requests. Okay.
And Armin, I just want to completely clarify, so I'm just going to use these numbers. $34 million to Ohio, $2.5 million directly to Cuyahoga County for that, approximately. This group has nothing to do with the $2.5 million.
That's correct.
Okay, so I just want to be clear.
Meaning, I'm sorry, Chair, it has nothing to do with it, meaning,
We don't recommend to Cuyahoga County what to do with their directed portion.
oh, that's
Of
a directed portion, so that doesn't come through us.
Correct, that goes straight.
That doesn't go through the foundation either.
Okay, that's like the other stuff that went directly to the municipalities.
Correct.
Okay, so people understand, the $2.5 million is going, and I'm just using
It's
these
my
estimates.
understanding, you know,
It goes directly to Cuyahoga County government, and they figure this out. We don't have a role in that. What we have a role in is that there is about approximately $19 million going to the foundation. We have a role in requesting of that $19 million, a certain amount of money to come to to Cuyahoga County projects. And
we know what you're thinking.
No, I'm not. I'm done in December. So that's the one we would, through this organization, we would then tell Judge Mataya to advocate for these things that we have put through to the foundation. Okay, so we will be the direct conduit to the foundation. Judge Mataya is representing us to advocate for us, but the relationship will depend on the bylaws. So if the bylaws do, as Armin says, no flexibility, everything we send, they're gonna have to approve. If they can reject, that's when we will need the judge to be able to advocate for the projects at Cuyahoga. Did I have this
I
right?
think that's, just a couple clarifications. I'm not sure if the money to the locals, the 34 million, will go just to the county or to cities and counties.
Okay.
That I just don't.
Yeah,
know.
I said ours being 2.5 would come directly to us.
No, I'm talking about ours, even ours, I'm not sure comes directly to the county as opposed to get split up.
Among the county and cities?
Yes, I just
Okay.
don't know that.
All right, can we, I have this, the disbursement of foundation funds by the board. Do we know, this comes from the,
That's the state MOU.
yeah, can we just make sure that this gets distributed to all the members as it,
Yeah,
and as the bylaws get
updated.
updated
Yeah, sure.
to do that?
We can do it again. I think we did before. Let's do it again.
Another thing I would just add, Dr. Boutros, Doctor,
Yeah.
is when I talked to Mr. Galucci, he indicated that he thought that the intent, because he was one of the people that wrote up the MOU, he thought the intent was that there be flexibility in the foundation and that they have the
Authority.
ability to say yea or nay on projects. So when we talked about it, that was never brought up at the foundation. It was open discussion, but that's the way he saw it.
Is there any other questions for County Executive Budish? Okay, great, thank you very much. Thank you for the update. Great, so back to the voting items, there's Region 3 MOU modifications. Is that the highlighted?
Mark, do you want to comment on this at all?
Sure, we're just going through some of the MOU that was all signed up last time. And there were a couple of clarifications we wanted to make regarding the quorum and proxy authority. And if you look at the way we suggested doing it, working with Brandy and Tyler and Greg Huth, is defining the different groups that are organized as appointing authorities. They're weighted by the number of members that are allowed to appoint to this body, but describing them as appointing authorities, and then the the quorum would be a majority of the appointing authorities represented by the members here. So if someone has three representatives or appointments to this body,
The counts as one.
exactly.
I
So
came up
that
with
we
the
only need technically 7 entities being represented rather than 11 people in the room. It's a majority of the entities being represented, not the members itself of the body, if that
Okay,
makes sense.
is this written up?
This was just something, a question that came up at the last meeting, so I think it's stated correctly here, but that was the clarification around it, correct, Mark?
Yeah, the quorum was mentioned twice in the document, and we're just picking the one that was easiest to achieve and eliminating the other one.
I think that's great.
So, I guess my question is
Yeah.
that, is there a new document that we need to present?
Brandy, was that in the packet? I didn't see the track changes one in the
I-
document.
indeed.
Tyler, do you have the, is this the one that the changes were made to from the law department today?
No, it's not.
I apologize, that wasn't here.
Okay, well, this needs to get resolved for us to be able to even vote, right? So,
Should we?
I think if we develop a consensus and people ratify their signatures on the prior document, we can proceed with the changes to the document.
could you, I'm gonna just ask you to state it clearly, and then I will forward the motion to make that clarification.
We'd like to clarify the MOU that a quorum is established through a majority of the entities represented on this body, and that those appointing authorities can designate different members to represent them on the body within 24 hours' notice.
So moved. Any second?
Second.
Any questions? Or further discussions?
Thank you.
Can I get all those in favor?
Aye.
Opposed? Abstain? All right, great. So we will ratify that by signature.
Thank you.
Thank you very, very much. Judge Mattia, you are just in time.
Just in time, yes. I apologize for my tardiness.
Well, no, it's okay. Just if you could give us a brief update on the state's foundation board as our representative, I would sincerely appreciate it.
Thanks. Glad you said brief.
Okay.
Because this could be a whole hour.
Yes.
Well, again, I appreciate being named the Region 3 board member for the One Ohio Foundation. I've attended 2 meetings since being named. The November meeting was canceled. So here's the start. The foundation, it was created by, you're talking about the MOU. This is the different MOU. This is the bigger MOU, which we could also call the Code of Regulations that was included in the material. So it was slightly modified over the last, or the first meeting I attended. The foundation, the One Ohio Foundation has a website, oneohiofoundation.com. That actually is pretty informative. I don't know if, Tyler, can we put that forward at some point? Just go to oneohiofoundation.com. It talks about the distribution of the pharmacy funds. Keeping track of the money is like advanced calculus because of the different sources of the money. They call it pharmacy settlement. And, this doesn't include what we saw yesterday in the news, the Walmart money yet. It doesn't include what's called McKinsey money. So it's hard to keep track of what's in the pot. The One Ohio Recovery Foundation has a nice website that states right on the pot, they have opioid distributor settlement dollars, a total of $808 million. And as you probably are aware, the document, the MOU, calls for those monies to be distributed. 55% go to the foundation, of which I'm our Cuyahoga County representative, one of 29 members of the board of directors. 30% of that money goes to local governments, and I don't know if you've talked about the check you've received, so
We discussed how that happens, and
so
The
this
15%
document is what you received as your respective local government. And it's a yearly payout, and the other 15% is going to the state of Ohio. So, we'll come back to this a little later, but, you know, there's not a lot to do with $309, especially if, you know, you're getting it in $1,000, $3,000 increments, so we might want to discuss if there's a common project we have in mind where we could pool all those monies to fund something worthwhile, because elsewhere I don't see how, you know, to pick Parma Heights, I don't know where Parma Heights is gonna put $2,818 to use that directly affects the opioid epidemic. You know, you might be able to buy some Narcan with it or something, but we'll see. So, the foundation, where we're at, and it's, this foundation is not distributed any money, it's not in a position to distribute any money at this point. What's holding that up is the, appointment of an executive director. So, but the foundation will have 55% of the 808 million, which is $444.4 million over the course of 18 years that it will be distributed. I talked to Frank Colucci yesterday, seeing if he could help me with the math, and came away even more confused. If you notice in this exhibit, not every municipality in the area is on this. I don't know why, but the participation of the entities that have been part of the litigation will affect payouts starting in years 3. So it's important that in a statewide effort, we try to get as many parties to the litigation to sign on to this as possible, because there are incentive payments that go with that. So in order to get the most money made available to all of us, be it municipalities, counties, and citizens of Ohio, we need to have a more fuller participation rate. I'm not saying that things will be bad without it, but we will do better by getting those, and I don't know who they are, who's not signed on to this yet, but we need to investigate that. So that will be paid out over 18 years. If you take 444 million of the, which is again the 55% share the foundation gets, divided by 18 years, it averages almost $25 million a year that the foundation will have to distribute. So there is a grant-making committee. I am got myself appointed to that. The good news is that is being headed by Tom Gregori. Tom Gregori is the dean of the Ohio State University Social Science School. So you have someone in charge of the grant-making process that is probably well attuned to evidence-based practices, you know, the whole lifespan of the crisis, and might have some good ideas on what to do about it. Tom forwarded the John Hopkins document that I've included that talks about the principles for grant making, guiding principles. We'll go over those in a second. But back to the executive director. So bottom line, the foundation has hired a search firm. They settled on Kittleman and Associates out of Chicago. I was on a conference call with them. There's again a smaller sub-search committee. So if you know anyone who you think would be a good executive director or would be interested in being an executive director of the One Ohio Foundation, please forward me their names and I will forward them to Kittleman.
What's that name?
Kittleman, Kittleman and Associates. And Michelle Sadler, Saddler, is one of the two individuals who was on the call with us. I can get you her direct email if you prefer to just forward her potential names. They have a hopeful date of having, the foundation has a hopeful date of July 1st of having an executive director on board. But how this works, according to the MOU, the foundation will forward 3 names to Governor DeWine, and then Governor DeWine will pick one of those 3 names. That's how it's laid out in the document. He doesn't have to pick. He can be unsatisfied with all 3 candidates, go back. So, but without an executive director, fund distribution and selection of grants are hard to do. So there's several policies. Benish Friedlander is helping put together the entire committee. So there's been several meetings where they just talk about, whistleblower policies and gift-making policies and various policies. So it's a little dull at this point. There's not a lot of action in that regard, but the MOU has kind of tied the hands, though, on the executive director process. And some on the committee are confident that there's a way around this, but I'm of the wait-and-see manner. You'll see in the MOU that the pay range, well, first of all, the candidates for executive director, according to the MOU, need 6 years experience in mental health, public health. They call it addiction, not substance abuse, so it's a little, they don't use that term much anymore. And who shall have also management experience. There was some concern amongst the members of the board at my first meeting that we, take out the mental health, public health, and addiction experience, thinking it would be hard to find someone with that. Between us, I just viewed that as an attempt to open it up to some friends, and that did not pass, and I vehemently opposed that. So I think, finding candidates won't be the hard part. Finding candidates who are willing to work for $115,000 a year is the problem, and that number comes from the MOU, which says the pay range shall be range 42 of the Department of Administrative Services exempt Schedule E2. Range 42 is $115,000 a year. Now, the members of the foundation think this position should pay anywhere from $200 to $400 a year to attract a worthy candidate. There's some members feel that they can use the McKinsey funds to supplement this Schedule 42. Some members think that, like some mayors are mayors and safety directors and can draw, one large salary from wearing 2 hats. There's a way around it, but frankly, it's a real problem at this point, and but there is optimism that can be overcome. So, the expert panel. So the foundation is to rely upon an expert panel in making in guiding its distribution process and the grant-making committee. No action has been taken on formulating an expert panel. The foundation board of 29, I think, picks 6 members of the expert panel. The governor appoints 2, and the attorney general appoints 1 of the 9 members. We have to see how the expert panel will guide the grant-making committee. The good news is there's time. There's time to put together your thoughts on grants. What would this region want to see or put funds towards with this money if it was obtained and given this way? Do we want to link with other nearby counties in creating a program or supplementing a program? Again, initially it sounds like a lot of money, but $24 million to spread throughout the state every year, you know, isn't a ton. So, so that's something to think about as this group continues to meet and go forward. You know, what do you want to do with the funds? And the good news again is, you know, everyone's concerned that funds don't be spent or infused into general funds, much like the various states did with the tobacco litigation. You know, the funds need to go to the opiate epidemic, either treatment, prevention, and remediation. Those principles are set out. We have an interim CFO. His name is Jim Quinn. We've rented out some temporary space in Polaris. We'll have our next meeting there. There's really no staff other than what, you know, Benish provides. Catherine Whittington is one of the county commissioners in Ashtabula County. She is the board chair. The executive committee is made up of one of the Cuyahoga County members, Dr. Michael Rosen at the Cleveland Clinic is one of the 5 members of the executive committee. The executive committee was already set by the time I was appointed. So the only other thing, this document, which is the John Hopkins document, which is a worthwhile read, talks about 5 principles, guiding principles in spending this money. Number 1, spend the money to save lives. Number 2, use evidence to guide spending. That is, you know, just because you think something's going to work, make sure it's proven, like medication-assisted treatment. Invest in youth prevention. Oh, sure. Invest in youth prevention. Now, I started drug court in 2008. I still marvel every day that I've got kids coming to it hooked on heroin. You know, everybody knows heroin's deadly, but we have to fight this from the demand side, not just the supply side. Number 4, focus on racial equity. And then number 5, develop a fair and transparent process for deciding where to spend the funding. So again, their website is very nice and very transparent. Lastly, there's some litigation outstanding by a man from Harm Reduction, Ohio, who couldn't get into the first meeting, and he is sued in Franklin County Common Pleas Court and directly with the Supreme Court. Those actions are pending. I think the Franklin County Common Pleas Court there should be some action on that soon. They had a hearing on October 27th. Initially, the judge said he was going to rule from the bench, which from a judge is kind of an unusual thing to say in a pretrial. Kind of telegraphs that you've already made up your mind. He didn't do that when he had the hearing, so but my guess would be his decision should be forthcoming soon based upon his prior comments. So, any questions?
Judge, if I may, have any thoughts about when the bylaws for that foundation will be set?
The bylaws are set, and they were included, and you can find them on the website.
Okay, could you,
They were the first 9 pages. That's the final
Yeah.
one. Yeah.
okay, great.
And there's more to it than those first 9 pages, but we didn't want to copy all 68 pages.
Okay, well, I think let's make it available at least through a link. If anybody wants to read all 68 pages, let them do that, but we'll make that. Second, I want to just make a clarification. The direct dollars to the municipalities, this advisory committee has no authority over. It's, you know, Judge has made a good point, is that it may be better to group the funds and for the municipalities to do that, but we don't have any authority over that. I think the most critical thing that we have to deal with and we need to discuss is how do we look at proposals that are submitted to this body so that we can advocate for them at the foundation level? Are we going to be a pass-through group that it doesn't matter, first come, first serve, we get proposals and we just send them across? Are we gonna have an evaluation process? Are we going to use the Johns Hopkins principles of saying you have to meet these 5 principles in order for you to submit a proposal to this group? I think that's the biggest missing piece for this advisory committee, is how to do that.
Tucker, I was gonna say, in response to what you were saying too, Judge, about feedback for, rationale for how the foundation will do it. We could pull in, obviously, local experts for both points to give feedback to the foundation or to help us, make our determinations. I mean, I think we have some on here, but we could reach out further for evaluation purposes. We could broaden this group for evaluation purposes. So.
Or idea purposes.
Yeah.
So I think, Matt, I'm gonna try to rephrase this, and that the advisory committee should look to experts to create a rubric by which proposals are going to be evaluated.
I was thinking we could do that, or we could even involve them directly in evaluation, but that's something like that.
So I think we have to count on a couple of things. We have to count on those people who are just gonna come to us and say, we have a proposal for the dollars, here you go, right? We're gonna have to count on people from this organization saying, we have an idea of how best to use these dollars, and this is gonna be generated through here. So I think they're all gonna have to be equally assessed, right? Whether it's one of us who says we should do this, or if it's somebody who doesn't participate in this group at all and says, I have an excellent program, I would like to propose that further. I mean, that's my thoughts. I just would ask everybody to kind of look into, to think about that and, give their thoughts.
I would just add, I think you're right, when we received the initial opioid settlement, that's exactly what happened. We kind of had 2 different sides, and different ideas on one and projects coming in on others, so, but I would just comment, I think that, rather than sending everything as a pass-through, and I think it's important for us to make decisions at the county level, that's.
And Tyler and I were talking the other day about procurement. How would we actually do it? Like the RFP process, or however we would entertain proposals, or whatever that would be.
I don't think that's even clear that there is an RFP process.
We'd have to. I think we'd make it up. I think.
If that's the way, yeah.
So that if could be time limits, there could be a lot of those different things. So these are the things that we'll have to look into. Any additional?
Yeah, here's one other thing I forgot to mention, and hopefully this will not ever be an issue, but, this whole 55% presumes that the One Ohio Foundation will get IRS 501c3 status. So, and that is not a done deal, and that will take time for the IRS to evaluate the application. The application has been made, I believe, but I don't know what happens if we, to this global agreement, if we had to go back to square one. But I would advise, so knowing what the monies are available, and it's each year over 18 years, and it's, about 25, maybe $30 million to distribute amongst the entire state. I think globally, I'll know more the next time we address. I'm sure the grant making committee will have met, and I'm hopeful that there'll be some movement on the expert panel to give some guidance as to what we're looking for. But Ohio's a very we're surrounded, metropolitan counties, we have a ton of resources compared to our smaller neighbors. Maybe linking with those smaller neighbors would make any kind of proposal look more attractive. If it's just an Uber service in from Geauga County to, the diversion center. And I'm not saying that's what it should be, but just those kinds of thoughts are kind of the thoughts that we should have.
Mr. Chairman, can I ask a question? I thought that, and obviously I could be wrong, that the determination for them to be annual payments hadn't been made yet. So they might be larger, 2 payments up front or something. Has that been determined? Obviously, it'd be nicer if they were larger payments up front than every year a little amount.
Yeah, the other website to go to is the National Opioid Settlement.com. And Tyler, we can distribute that after the meeting. That's even more, there are even more places to get lost on that. But there is a section on there that explains the incentives that increase over the years. I'm pretty sure it's 18 years though.
I just did the money, when you said annual allocations of money, I thought that they had discussed the idea of giving, it's 18 years total, but giving, larger amounts up front
Front-loaded.
and not,
Yeah, I think
which
you're right
makes
about
sense
being
for
front-loaded, but I cannot figure out what that means in terms of percentages or dollars or, but so, that's why I kind of narrowed it down doing the math. Again, 55% of 808 is 444 million, divide that by 18 years, about 25 million. But if you put the Walmart money in, which is another 114 million, 55% of that is 507 million. So you're up to $500 million. It's just a little bit more, but you're still, it gives you enough of a ballpark to know, and that's for the whole state. So,
I'm sorry, so if I may I make a proposal? If it would be good for us, and I'll let this group pick to have somewhere around, I would say, 5 experts on substance use disorders who can create a rubric for us to assess the process. That would be one group, and I would ask if you agree to also create an RFP, ask the county with their expertise to create an RFP process so that we're not getting random proposals that we have, dates set for this quarter. You have to submit your proposals by the state, and then it gets evaluated through that rubric, and then we make a determination the next quarter. It gets proposed by this state, and you have to have these things. And so these are my two recommendations. Is one, the county create an RFP process by which anybody can apply to it, this body or anybody else, and that we ask from the members of this advisory for them to nominate 5 people who can help create the rubric for assessment, so that we can make better decisions. That makes sense to people. Any thoughts about these 2 ideas?
Makes sense to me.
Okay, so I'm just gonna make a motion to ask the county to create the RFP process, and ask for us to send a survey to the members to ask for nominations for this, and to be able to get them in by the end of the month. And if there are more than 5 folks, we will try to send a survey out for you to rank order and see if we can pick the 5 top folks, if that's okay. So that's my motion. And I know chairs don't typically do motions, but that's the motion. I'm not your typical chair, so.
Dr. just to clarify, Judge, I'm sorry, did you, for that expert group, did you say before that some feedback to the foundation would also be useful, like on their process, or did I hear that wrong?
it has not been worked out yet. So the MOU calls for the creation of an expert panel to assist the 29 foundation board members.
Yeah.
The 29 foundation board members also have a sub-grant making committee. How they all mesh and work together is, I don't know.
Well, I guess if we have the
But
experts.
while we're waiting for that,
Yeah.
I think it would be time well spent on doing an RFP process, getting the minds thinking, okay, we know roughly what we might have. What can we do with it that will be good.
So,
I'd like to make a motion to approve the discussed motion.
Just one question about the 5 experts. Somebody who I'm thinking of might eventually want to apply, so I think we want to be careful that
apply for what?
apply for a grant potentially. So I think we want to make sure the 5 experts are only to design the rubric. And would that make sure it doesn't preclude them from then applying?
Yes, I think you would be
Separate.
best is that they're not gonna be doing the evaluation, they're gonna be
Right.
creating the rubric.
tool.
And we can have, maybe assign somebody to assess all of those or ask for another group. But yes, designing the rubric, period. All right, so we have the modified motion.
I don't think you have to modify, I just
Okay.
want to make sure there
So-
isn't a conflict potentially down the road.
Do we have a
Those votes.
motion? Any
Second.
second?
I'll second.
Any further discussion? All in favor?
Aye.
Opposed? Abstentions? Great. All right, setting the 2023 meeting schedule. We have set the mid-month of the second month of the quarter. So it'll be February 15th. We're trying to make them around holidays, so right around Valentine's Day. May 16th, August 15th, and November 14th. And Tyler, we can send those out, please, to everybody.
Sure.
Is there any objections to that calendar?
3 o'clock,
Yes, same time, same bat channel, same bat.
not 3:30, 3 o'clock,
Yeah,
okay,
yeah,
I
yes,
got
3
that now.
o'clock. Any new business? Any old business? Okay, meeting is adjourned. Thank you very much.
Chairman.
Thank you.
Hey,
You got it.